you had a good week. I almost canceled this week, but we have so much to talk about. I just wanted to make sure that that I was able to update you about a lot of the developments that we're hearing about here at Public Health, and we just want to make sure that we have at least a start of some dialogue related to the things that we're observing here, and are getting updates about from our state partners. So with that, and with no further ado, I'll just start. Just by way of agenda, like I said, I apologize, my video is not working. I don't really need to share my screen today. We'll talk about cases, what's going on in the hospitals in terms of numbers, the tier and the blueprint that the state is going to be holding us to. We'll discuss antigen testing, and a new monoclonal antibody, which is going to be authorized for emergency use, preparation for vaccine deployment, and then some wintertime related updates related to carbon monoxide, and then some new guidelines from the state related to holiday gatherings and Thanksgiving. So that's what I have in store. I know that's a long list. I tend to talk fast anyway, so I think we will have some time left over if you have any questions. Okay, so we'll start with the case counts. Currently there's 33,459 cases and 459 deaths that are registered across our county. The number of cases has really accelerated, and we are experiencing a surge. I'll be very blunt about that. We are in a state, the whole state is experiencing this surge, and we're not being spared here in Fresno County. We've been adding more than 200 cases every day for the last few days, all of which is pointing to us going back into the purple tier when the state makes its announcement on Tuesday. In terms of what the hospitals are doing, well, most of you are seeing in your clinical practices just a lot more people coming in with either coronavirus symptoms or coronavirus exposure. And the hospitals are currently holding 120 patients, including 28 in the ICU. So there is an uptick there of just probably several dozen over the last month. And just keep in mind that, you know, as people get discharged, new people get admitted. So the numbers themselves don't reflect the number of, I think, new cases that are being seen in the hospitals. At the same time, I think it's a good opportunity to remind everyone that we're getting infections in healthcare workers being diagnosed. So just keep that in mind, that you know, our hospital staff, our nursing staff, our clinicians, our ancillary staff, respiratory therapists, etc. They're all at risk, and we really do need to take care of them as best as possible. Obviously, that includes prevention, making sure that they are kept safe just with all of the protocols, making sure that we're providing spaces for them to take breaks in a way that's safe, preferably outdoors, obviously doing the screening and the temperature checks. The CDC is now releasing guidance that the screening and the temperature checks are not perfect. I think that that's pretty intuitive, knowing that this is a viral infection that's often carried asymptomatically. But just keep that in mind, that even that is not a perfect system. And I think one more layer that makes a lot of sense to introduce is surveillance testing. I've talked about this before. I would advocate doing 10 to 20% of your hospital or clinic staff getting tested every 2 to 4 weeks. And really using our OptumServe sites is probably the best resource because they can get registered. Once they have an account, they can actually just walk in and get a test really quickly. We have lots of slots available every single day at our OptumServe sites. So please get in the habit of, you know, I think we're all in the habit of wearing masks. We're all getting used to the habit of checking our temperature and doing the daily screening. And now it's time for us to get in the habit of doing routine surveillance testing just to keep ourselves safe. There's no perfect recipe that's applicable to every single situation. in terms of how frequently you should do it or how many people you should involve. In general, the more often you do it and the more people you involve, the safer you will be able to keep people. But I understand that that comes up against logistical challenges. With our schools, we recommended once a month testing of 10% of their staff. With our healthcare workers, I would probably increase that frequency to every 2 weeks and increase the number tested to 20%. And that's probably where I would land if I had to create a surveillance paradigm for a large healthcare organization. We can talk more about how to make that happen, how to achieve that. Just keep in mind that with the Optum Serve sites, because those are all essential workers, that's actually covered. So then you're just left with carving out time for them to go get it done, and then obviously having protocols in place so that if they do come up positive, that they're able to stay home from work so that they're not infecting their peers. But that should not be seen as a deficit. That should be seen as a benefit of doing surveillance testing. In terms of the tier statistics, so we're currently in the red tier, but we're just barely hanging on. And in fact, we're going to be going into the purple tier if our projections are correct. And that's just because even though we're in the red tier, one of our metrics is already in the purple, and we think the other metric might be in the purple. All you need is 2 weeks in the purple for one of our metrics, and then the state will put us in purple. So the way things are going, we think that our case rate is going to be higher than 7. It was 7.9 last week. It's probably going to be closer to 10 this next week. And so that's what's going to tip us over into the purple. In terms of our positivity rate, it's only 5.5% overall, but our equity quartile, which is the lowest 25% of all of our census tracts, that positivity rate is 8.3%. And some of our clinics are giving us back positivity numbers of like closer to 20%. So there are hotspots within our county that are driving these infections, but it really seems to be a global county-wide increase in transmission. And we anticipate that this is going to continue for some weeks. We just hope that by going back into purple, that we're really signaling to our general public that it's time to stay home instead of going out and about. It's time to cancel your parties. It's time to cancel having dinner with your friends. It's time to just cut down on all those social activities so that we can catch up and do contact tracing on the cases that we're identifying already. And we can kind of clear the air, as it were, with this unmitigated transmission that we're now seeing across the county. That is coming up right on the heels of Thanksgiving, when we know that people like to have a lot of gatherings. And so that's something else that we need to start messaging about, is how to do Thanksgiving safely. And that will mean really avoiding travel to hotspots and from hotspots, trying to do things remotely as much as possible. If you are going to have a Thanksgiving gathering, make it super authentic by having it outdoors, just the way that the original settlers and natives did. And make sure that everyone is wearing a mask while they're indoors. Even if you're around your relatives, even if you're around your favorite aunt and uncle, that doesn't mean that they can't give you coronavirus. You just need to be masked up anytime that you're indoors, whether it's a place of business, a place of dining, or a relative's house. Wear a mask while indoors. And then if you're in a high-risk category just because of comorbid conditions, go ahead and cancel your plans. That's really the best thing we can advise to our patients to keep them safe. During this time, I know it's a hardship not to be able to see family and friends, but that's really the safest thing we can do. And hopefully this is just a temporary hardship because we're getting such good news on things like vaccines and therapeutics. So speaking of vaccines and therapeutics, the state is actively planning out mass vaccination and how to deploy it. The two major candidates that they've already kind of started to name in their conversations include the Pfizer product and the Moderna product. Neither one of these is currently approved for FDA emergency use, but that might happen as early as mid-December is what we're anticipating. So we only have a month to really prepare this vaccination plan and paradigm. Both of these vaccines need to be kept very cold. The Pfizer product has to be kept at -80 degrees Celsius. The Moderna product has to be kept at -20 degrees Celsius. So you have to have these ultra cold freezers and a lot of dry ice in order to maintain that cold chain. And we'll get more instructions about how to do that. But that's a major logistical challenge with this vaccine as opposed to other vaccines like the influenza vaccine. In terms of when these doses are available, the first kind of wave or priority will be given to healthcare workers, first responders, and people with comorbid conditions, specifically those from vulnerable populations and counties. And I could just tell you that the state has shared a map, and Fresno is right at the top of vulnerable populations, including vulnerable populations of our healthcare workers. So a lot of our healthcare workers are members of minorities and also have comorbid conditions, et cetera, which would make them especially vulnerable to coronavirus. The state is sensitive to that, and so they are going to prioritize Fresno County as one of the counties that's going to get the initial doses of vaccines. I wish I had more numbers for you and more of a hard date for when this is going to happen. They just haven't released that information. So all I can tell you is, we are foremost in their plans as a county. And I know many of our hospital partners have already filled out surveys about how many employees they have on staff, trying to estimate what their storage capacity will be for ultra cold storage and other plans that they might have to be able to deploy vaccines whenever they become available. So we feel like we're in good shape to do this planning. We just need to have more and deeper conversations about getting it done. We're hoping that over the next few months and hopefully by next summer, definitely, that we will be able to vaccinate everyone. And that includes older adults that are in the community, older adults that are in congregate settings, members of the community that are homeless, that are at higher risk just because they're incarcerated or having to stay in congregate settings, and then critical infrastructure workers across all occupations, including the food and agriculture industry, the transportation industry, other critical infrastructure, and also all of our teachers and those that are in education. So really, there's a plan to vaccinate everyone eventually, and they're really just trying to prioritize those who are at highest risk of getting this infection, highest risk of dying from this infection, and highest risk of being vectors for transmission just because they're on the front lines of public service. There's a more, I think, immediate availability of therapeutics that is kind of exciting to talk about. One of them is an antibody infusion. This is a monoclonal antibody. This is not the famous or infamous product that the president received, but this is a related product made by a different company. So this is an Eli Lilly product. I can't even pronounce it. It starts with a B, and it's like bamlanivimab. So it's a monoclonal antibody made by Eli Lilly. And just like remdesivir, the company is actually allocating doses to be given out to patients. And they're basically giving it to the state. The state is giving it to the county, and the county is going to be helping to distribute it to our local hospital partners. This is a kind of a cool product because it's actually designed for outpatient infusion. So as soon as a patient is diagnosed with coronavirus and they're determined not to require hospital admission, then they would qualify. And there's a few other inclusion and exclusion criteria, but they would qualify for having a one-time infusion of this monoclonal antibody, which would then hopefully jumpstart their ability to fight the virus with this product. So obviously more research needs to be done about how successful this strategy will be. But again, it's reserved for kind of the lower risk patients who are going to go home anyway. And whereas before we would just tell them to go home and try to recover on their own and come back if they need extra help, now we'll be able to offer for some patients this antibody infusion if they are otherwise in a higher risk category based on their age and their comorbid conditions and things like their BMI, et cetera. So we'll share more information about this. We're already sharing it with our hospital partners who will be instrumental in helping to actually administer this medication. The way that it's designed, it's possible that nursing homes and other kind of outpatient ambulatory settings might be able to administer this medication. But given the timing of this, I mean, we found out on Tuesday afternoon, and we had to make some commitments by Thursday about who was going to get it and how much we needed. So we just kind of jumped on it and said, yes, please send us some, and we'll figure out exactly, where it can be allocated later, knowing that this, just like with remdesivir, this program will be refined week after week, and that we will be able to change the number of allocations and the destinations for where this medication is going based on the feedback that we receive from our partners. I just think it's exciting to be able to have this category of medication available for some patients. And hopefully, we'll see some really good data emerging from how well it does. All right, let's talk about antigen testing. So this is another kind of resource that we have available here in Fresno County. Some of you are already doing antigen testing with, for example, the Sophia Quidel and the BD Veritor technologies. The county has received 18,000 Binax antigen cards. This is an Abbott product. This does not actually require a tabletop machine. The card is kind of self-contained. You swab the patient, and then you put the Q-tip inside the card, and then the card sort of does a chemical reaction based on antigen matching, and then gives you a diagnosis of yes or no antigen detected. So this is an exciting technology. It's something that does require some technical training and requires that the person doing the test report back to the Abbott company as well as to the health department what the test result was, and then obviously you'll want to be able to interpret the test result for your patients as well. So those are all really exciting elements of this technology. We are basically at a point where we finalize the packet that we're going to send out to people. So if you've reached out to us, you can expect that we will email you this packet. It will require you to kind of sign off on your understanding of inclusion and exclusion criteria. Remember that the patient has to be symptomatic within the first 5 days of their symptoms, and also that you or your staff need to sign off on the training that's required in order to do the reporting into our database. So we're really hoping to partner with many of you and many others in the community to provide this antigen testing for our patients. And we're keeping our fingers crossed that we will get these cards out and start getting them used as early as next week. And I think the last thing that I need to talk about is just with the wintertime weather. This is going to lead to some changes in behavior, obviously. First of all, people are going to want to gather more indoors. Please stress to them that that's high risk, that even if they have to throw on a coat or throw on multiple layers, put on a hat, put on gloves, that they really need to try to stay outdoors as much as possible, especially if they're going to gather outside their household. I can't stress that enough, that this year, even though it's a hardship, we really have to keep people outdoors as much as possible. Because otherwise we're going to be spreading the infection, especially as they're doing their social activities. So, gatherings, hopefully everybody has the message that gatherings are just not a good idea right now. But if they are going to choose to have gatherings, then they need to be doing it outdoors. If they're going to choose to have gatherings where food is involved, that definitely needs to be done outdoors. Please hammer that into your patients so that they understand what's at stake whenever they choose to share a meal with people indoors. The next issue with the cold weather is that a lot of people are going to be starting to use heating and other trying to heat their homes. And sometimes people like to basically use techniques that can lead to carbon monoxide poisoning. So this is definitely a wintertime poisoning. It's usually due to the use of fireplaces that don't have good ventilation, or the use of fire sources that just allow carbon monoxide to accumulate indoors. So, working at the poison center, we hear crazy stories like people that are using generators to power heating devices, and the generators basically don't have a way to vent the exhaust, and then that leads to carbon monoxide inside their rooms. Sometimes it's not even living spaces. Sometimes it's garages that people are using generators, and they don't really think of a garage as a place that they really need to be too worried about. But people spend a lot of time in their garage, and if the garage isn't well vented, that can actually lead to a lot of carbon monoxide accumulation. Some people actually get very desperate, and it's almost tragic to talk about, but sometimes they'll actually pull in their barbecue grill and then use the barbecue grill to heat their home because they have no other way to heat their home. And that basically leads to not only a lot of just terrible smoke that's very obvious, it can also lead to carbon monoxide, which, as you'll recall, is odorless, and may not even trigger any warning by the time that it gets accumulated to life-threatening levels. Signs and symptoms of carbon monoxide can include just anything related to ischemia, so headaches, flu-like illness, chest pain in people that have cardiovascular disease, definitely shortness of breath, and then unfortunately even sudden death can occur if it's low level, long duration. And you don't have to have an open flame. This person doesn't have to be a fire survivor. It can be just someone that's trying to heat their home in good faith, and then they end up having just a very unlucky event. So please consider that, especially if you're seeing people, for better or for worse, carbon monoxide poisoning, whenever it's mild, can actually look like influenza, believe it or not. People will have headaches, flu-like illness, just aches and pains, low energy level. Typically, it gets better whenever they go outdoors. And typically, if multiple members of a family and even the pets are affected, then you know that you're dealing with an environmental hazard like carbon monoxide. But I always like to alert people about this because year after year, the Poison Control Center hears about cases that could have been preventable with a little bit more education. And lastly, we're going to be sending out more information related to Thanksgiving on our website. So please check back on the county website. But the state has already told all of the residents of California, and in fact, all of the West Coast states have done this. They basically said if people are coming from the Midwest, that they need to quarantine for 2 weeks before they go out and about and use businesses in the state of California. And that's just because we don't want to import Midwestern infection into our already surging transmission rates. I mean, it's really hard to predict what's going to happen in the next 2 weeks, but this basically is a very strong signal that travel is a bad idea this year, whether you're going to an area that's a hotspot or coming from an area that's a hotspot. You're basically just increasing your risk. Not to mention that you may be staying at a hotel, using gas stations, restrooms, places of dining and business that all may increase your risk of picking up a germ, whether that's influenza or another wintertime virus or coronavirus. Travel is just not being advised this year. The last thing that I want to add is, I think we're under testing related to the amount of resources that we have in the county. And I really do want to encourage everyone. The surveillance testing is one way that we can increase testing. Another way to increase testing is, if people are adamant that they are going to have a gathering, then please try to convince them to get tested in the 48 to 72 hours before they have the gathering. And that will at least reassure them that they're negative and provide some semblance of a rational approach to gatherings. And obviously, if they're positive, that's all the more reason for them to not participate. So if you find out either among your staff, your relatives, or your patients that they are going to participate in gatherings, then really just talk to them and say, look, you should get tested at OptumServe, and have everybody that's coming to this gathering get tested at OptumServe so that we can all gather safely and have that reassurance that we're not having silent spread whenever we choose to have this gathering. Again, it's not ideal. The ideal is just not to have the gathering at all. But if people are going to go out and do it, then one, I guess, approach to harm reduction is to have people get tested, and hopefully that will increase our testing rate as well, which will help us with our blueprint metrics. The last thing I want to say, and then I'll open it up to Q&A, is that we are getting 3 more OptumServe sites. Each of these sites can do about 150 tests a day. So that will translate, whenever these sites are ready and operating, into 500 more tests per day that are available. And like I said, they're free. They cover almost everyone, especially all of our essential workers. All they do is require a pre-registration via email. I myself just went into it today and got myself registered to get tested next week, just because I just want to participate in this routine surveillance testing. And being a frontline worker myself in the emergency department, I think that all of us can lead by example, and just go ahead and get tested once every few weeks, just to make sure that we don't have silent coronavirus infection. So that's how that's my take on getting tested. I hope all of you have had the experience of getting tested. If you have, you know that it's not terribly inconvenient or uncomfortable, and that it's worth doing just to have that clean result. And then obviously, if you do have a positive coronavirus, then it's really important for you to know as soon as possible, so that you can make adjustments to your schedule and protect your family and your coworkers with that information. Okay, that's all I have. Let me look at the chat box and see what sort of questions are coming in. And so one question is, what is the false positive rate on the antigen card? That's a good question. I really haven't seen that there is false positive. What I've seen is that the sensitivity and specificity is 98% and 90%. So, for the most part, if somebody is symptomatic and it's read as positive, I would just assume that they have COVID and really give them instructions. Remember, even if it's not coronavirus 19 or COVID-19, it could be another form of coronavirus, which would still be infectious. It would still cause symptoms in the next person. And so the best thing that person can do is just isolate until they get better. So even if it is a false positive, quote unquote, it probably still adds value, because then you can be sure that person is not passing on another kind of virus to somebody else. How long are we required to keep the daily employee questionnaires? For pre-op patients, are the area hospitals requiring a PCR test that needs to go to a lab, or a rapid BD test? So I'm not sure what the hospitals require. I would say a PCR test is the gold standard. And that's what I would do, because all of the antigen tests are only appropriate to do for people that are symptomatic. And so the PCR test is what should be done for pre-op patients. Other hospitals or other ambulatory surgical centers may have different approaches, but you have to keep in mind that an antigen test could not detect a patient who's not symptomatic and yet is still infected. Whether that person is very infectious and high risk is another issue, but we know that the gold standard is PCR. How long are we required to keep the daily employee questionnaires? That's a good question. There's really not any guidance from the state or the CDC about that. I think it's really just a matter of making sure that you have a defensible strategy, just from an HR perspective and from a litigation perspective, so that you can document that you have a good paper trail of making sure that you have employee screening in place. Beyond that, it's hard for me to give you a recommendation for how long you have to keep those questionnaires. How do we request an Abbott Binax Now card? Just email us and we can get back to you with that information. We'll probably have a tab on our website soon where you can request directly and then fill in information about where we can send those cards, and we'll have the packet for you to download as well. Are there free testing sites available for patients? Yeah, that's what the OptumServe sites can provide. There's also another site called the UCSF Fresno COVID Equity Project. Um, the COVID Equity Project is doing such a great job that they've actually, in some ways, become a victim of their own success. The word is out that they do an amazing job, and just like our emergency departments, this is where people go if they don't have anywhere else to go. And so they've kind of run into some issues with supply and just throughput. So I would encourage people to use OptumServe, even though you have to pre-register. They actually have a lot of availability throughout this week and definitely next week. And that's where I would send people to get free testing done. Now, keep in mind that urgent care centers and even primary care doctors are going to be able to bill insurance if people are symptomatic, or if they're involved in an outbreak, or if they're an essential care worker. And so in that sense, any site that's doing COVID could be doing it for free as long as those qualifications, one of those qualifications are met. On the chat box, they are telling me to please mention blood donations are seriously needed. So I bet that that's my friend Chris Staub, and he is just mentioning that the Central California Blood Center continues to struggle with getting donors to step up and donate. Obviously, donors that have had coronavirus are very much in high demand because of their ability to donate convalescent plasma antibodies. But even beyond that, just basic blood products are in short supply, and anyone can be a real lifesaver if they donate. So keep that in mind so that you can help spread the word about that very important process. More information about the convalescent plasma. It's in good supply. We're labeling the products as high titer when new testing indicates the potency meets the FDA requirements, and the usage of convalescent plasma remains robust in the Valley and around the nation. So that's good to know that it is being used and that the science on that is evolving to where we can now really figure out which donors have high levels of antibody and really ask them to donate multiple times so that we can really harvest as much of that antibody as possible for the benefit of other patients. For the 20% surveillance at healthcare provider office, do you have something in writing to share for a possible policy and procedure in our clinic? You know what? We don't yet. We're still workshopping it. So we're hoping to have that out soon. I'm just really in the process where we need to think through what this is going to look like, how it would work. I think this is one of those situations where if you're a small employer or a small clinic and you have a small staff and you're able to get it done, that will probably be easier for you. But we need to create a policy and procedure that covers all healthcare providers, including some of our larger employers, such as skilled nursing facilities and our hospitals, obviously, and even our ambulance providers. So that's where we're really trying to make sure that this is something that works for everyone and actually doesn't create more problems than it solves. So we're still thinking through some of the logistical issues and implications of creating basically a mandate to make healthcare providers do a 20% surveillance. I see that there's a lot of benefits to it, but it needs to be done properly, and we would never kind of spring this on everyone without workshopping it and getting feedback from all of the stakeholders and partners involved. But just keep in mind that, you know, healthcare workers are definitely on the front lines, so it's no surprise to anyone whenever healthcare workers contract coronavirus. It's obviously still very tragic to hear about people who get hospitalized, healthcare workers who have complications from coronavirus that they've contracted in the line of duty. So it's a tragedy that we want to avert. And we really feel like as this surge deepens, the lessons from other countries and other parts of the U.S. provide stark warnings to us that, you know, as our numbers go up, there's a tipping point where you really are, the healthcare system can really capsize. Um, and I don't want to, say that flippantly. You know, there is that danger that we really could really start having so much infection in our healthcare workers that we can't take care of anyone for anything. And that's a nightmare scenario, but it's something that's been well described with coronavirus. So that's why we want to protect our healthcare workforce as best as we can. That's really been our intention with the mask mandate, which we put out very early on, the screening and the temperature checks, and now with this testing surveillance paradigm, we're really just trying to protect the healthcare workforce with the resources that we currently have. I think we're there with the amount of testing that we're able to offer, especially having, you know, a total of 6 to 7 OptumServe sites in our county. That will be tremendous. And as soon as those are ready to go, it makes so much sense to make sure that all of our healthcare workers just get into a habit of getting tested every 2 weeks. If not all of our healthcare workers, then at least 20% of them, so that we can stay on top of clusters and outbreaks as those happen. But there's no reason to wait. I mean, anyone can sign up to get registered with an OptumServe site. And once you have an account, they kind of give you an ID, and then you just use that ID to sign up for tests anytime you want. And I've been told that you can just walk into an OptumServe site with that ID, and they can actually register you for a test that very day. So it ends up being very, very useful just to have that account. And I really encourage everyone to, you know, get to know the OptumServe system, because it's going to be here for the time being. All right, I think that takes care of the chat questions. Are there any other comments? Actually, Richard Lembo answered a question much better than I did, so I'm just going to share his answer. And this was a question about how long do you keep the questionnaires on your employees? And Richard says, we keep them for 14 to 16 days because that's the incubation period. And that makes a lot of sense, because honestly, the only time you're going to go back and look at old questionnaires from your employees is if you have an outbreak. And then you're going to want to go back and check and see, you know, if you could track back that outbreak and see if anybody skipped a questionnaire or failed a questionnaire, or for whatever reason a questionnaire wasn't done. And really a period of 14 to 16 days makes sense, because that's the incubation period of the virus. And so if they are kind of a silent infection that spreads to other people, it's going to happen 2 weeks after their last contact. So for what it's worth, if you can't keep them for a longer amount of time, then at least keep them at a minimum of 14 days, so that you can kind of keep track of at least one incubation period since that employee was checked. And that might help you later down the line to help with your contact tracing. Any other questions or comments? Well, I hope you enjoy this weekend. Take care of yourself. Spend time in the great outdoors, enjoying this brisk weather that we're having. And just brace yourself, because we are going to go into purple. And that's going to mean that, you know, a lot of our indoor operations will need to close, with our restaurants, our places of worship, our gyms, and other places that will need to kind of curb their indoor operation. And at the same time, we will most likely have you know, some very sobering statistics next week. That's what we're seeing here at the health department, and that's what we anticipate that the state will be sharing about our county. So I hope that that's not a source of surprise for anyone. But I'm optimistic that we will get through this. You know, our testing capacity is better than it's ever been, even if our actual testing numbers are not. But that's something that we can all work on. If you're running into problems with your vendors and suppliers in terms of getting testing done, please reach out to us. We're happy to help support you. Some of you have already reached out about Binax antigen cards, and we're happy to help support you, and we will reach out and get those provided to you. In the meantime, take care of yourself and your relatives, and make plans for a happy and safe and socially distanced Thanksgiving, which is going to come up before we know it. Thanks, everybody. Have a great day.